Right now, what I'd like to do is the last step in today's activities before refreshments, and then, of course, the public lecture at 7. I would like to call upon Charmaine Spencer, and we're going to have she, as a research associate and immediate past co-chair of the Canadian Network for Prevention of Elder Abuse, I believe, get an award. So Charmaine, do you want to come up here and you're going to distribute some awards? Is that correct? Yes. Okay. You shouldn't have been so far there away. Now you've got to come all the way to the front. And while Charmaine's coming up here, I just want to thank Gloria for all of us for creating the Gerontology Research Center, for being the first director of the center and director of the programs, indeed, for hiring me. And then there was this reproduction of all these faculty and other people, and together we have this wonderful gerontology community with wonderful students as well. So thank you very much, Gloria. Charmaine Spencer.
Long day. It is with a great pleasure for me to have this opportunity to give out the 2012 Elder Abuse Awareness to Action Awards. One of the things that the Gerontology Research Center and the Research Department has done over the years is really celebrated the excellence in efforts at a community level that have been occurring, both in terms of seniors leadership and in terms of grassroots work across the province. In 2006, in recognition and actually in celebration of the first World Elder Abuse Awareness Day, the Simon Fraser University's the Gerontology Research Center developed or created the Awareness to Action Award, basically again to serve to celebrate the really wonderful work being done in different parts of the province around abuse and neglect awareness. We have the different kinds of categories within this. One is in terms of individual efforts. There's organizational kinds of efforts. And then there's also in terms of either governmental, corporate efforts and media efforts. This year, we were again delighted by the response that we had, and just sort of the heartfelt responses from people in terms of people that they considered really worthy of receiving these particular awards. And we have the now I don't know if all 4 people are here today, but just to let you know who they are and just a little bit about them. One is, and in no particular order, is Amanda Brown from Vancouver Coastal Health. The second one is Leanne Lang, again from Vancouver Coastal Health. Second is the BC Centre for Elder Advocacy and Support, and the fourth is Margaret Easton. What I'll do is sort of one by one give you a little bit of information about them, and you can gauge just and see how much they have contributed to this really important issue within British Columbia.
Could we have those 4 people come forward? All the way up here to the stage.
The first person who's on the list is Margaret Easton, who has been working around the financial issues and financial abuse issues actually for quite an extended period of time. She has over 30 years of experience in financial services industry, in both in banks, trust companies, and credit unions in Alberta and British Columbia. She subsequently took that experience, that lifelong experience, and started applying it and using it in terms of really helping to educate service providers about the issues in terms of financial abuse. In 2008, for example, she was really a pivotal part of a federal, provincial, territorial forum specifically talking about financial abuse issues, and extremely well received, worked within that. She also works and has a passion around mediation issues in this area, really understanding sort of both the complexities within the context of families and relationships, issues that are really fundamental for responding in a non-ageist and a supportive kind of way around both preventing and addressing financial abuse. So the first award for today will be to Margaret Easton. Please, thank you. The second award is going to an organization. It's an organization that I've certainly known for a very, very long time. I've actually worked on projects with them from time to time, and they have a long history working both on the prevention and the support and assistance side, and that is BCC's, BC Centre for Elder Advocacy and Support. BCC's has really grown over the years, keeping both its grassroots kind of approach, but also expanding into new areas. Some of the things that BCC's currently does is it has a seniors information line, which I think in 2011 had over 2,000 calls from both seniors and others seeking assistance around abuse issues, but also other kinds of advocacy issues as well. The other thing that has been really quite remarkable is the development of the Elder Law Clinic with BCC's. It's a phenomenal development. It was started as a germ of an idea at a community level, was nurtured through its first beginning steps by Joan Braun, and now under the wonderful leadership of Jane Lewis. I would like to thank and BCC's for the decades of work that they've done in this area and their future work as well. Thank you. Now the next two are almost like a tag team. And this is Amanda Brown and Leanne Lang. You know that when you're getting multiple responses from people in terms of the nominations, that you definitely have really great winners. And that applies to all four of the winners for this year. But the work that Amanda and Leanne have done, it has reverberated throughout the province. Basically, I mean, among many other things, back in 2005, I have absolutely no idea how it actually happened, but somehow somebody convinced Vancouver Coastal Health Authority that it was a good idea to help their staff better understand and recognize and respond to different kinds of abuse and neglect. Vancouver Coastal Health, through Amanda and Leanne, basically created the REACT manual and have been providing wonderful training for service providers, for health service providers, so that they are better trained and in a better position to be able to respond in a very supportive kind of way. And I think one of the things that what has happened over the course of the years is we recognize that not only the need for the sort of the essential, the basics of education for healthcare providers, but also that more sophisticated, detailed kinds of level of understanding and a more diverse kind of understanding. So the second part of the work that both Amanda and Leanne have been involved with is in terms of the development of a very special REACT kind of information and education and training specifically for First Nations. It started locally and has expanded throughout the province. Wonderful from a community development perspective, wonderful in terms of dissemination of information, wonderful in terms of sharing of ideas. These women, in addition to the to our other winners for this year, really demonstrate so clearly the passion, the caring, and the respectful support for older adults who are experiencing mistreatment. I'd like to thank, the last two awards are for Amanda Brown and Leanne Lang. Amanda's not here. Yeah. I can take Amanda's. There we go. Thank you very much to everybody here.